Minister to do a U-turn at this stage then is despicable, and we're not going to accept that. I know there's an issue of time, and I'm grateful to have the opportunity, but this is important for Donegal.
Thank you, Deputy Thomas Pringle.
Thank you, Cahir. I'd like to thank the Cancora for allowing this topical issue debate to be taken today. And while I respect the fact that Minister Borden is here to take the issue, I am disappointed that the Minister couldn't see fit to come to himself to the House today to deal with this matter. And the purpose of the topical issues was that the Ministers should be available and make themselves available to deal with the issues, because they are obviously important issues for the constituencies that we represent. Minister, as has been said, in January 2016, Minister Joe McHugh announced that the second breast cancer surgeon was approved for Letterkenny and recruitment would start straight away. And now we know that what that was an empty pre-election promise, because we have seen nothing actually happen since then. And as has been said, we're over almost a year and a half later, and we haven't seen any action take place. And while that goes on, the number of referrals continues to grow. Currently, there are an average of 1,950 referrals to the breast clinic in Letterkenny every year, dealt with by a single surgeon who does Trojan work there and is so passionate about looking after the patients that he sees and making sure that the service is maintained and developed in Letterkenny. Because, Minister, I know it's hard for people in Dublin to understand, but it's a 4.5-hour trip from Inishowen to Galway to attend the clinics there for patients who are ill, patients who are worried that they might be ill and might receive a diagnosis of cancer. So it's vitally important that this service is continued to grow in Letterkenny, and the way to do that is to appoint the second breast surgeon, and that would allow the waiting list to be shortened. And I can only think that it's a deliberate policy on behalf of the National Cancer Control Programme and the HSE to ensure that this situation as an appointment doesn't take place, and that the waiting list continue to grow, so that the demand will be then to move the services entirely to Galway. And Minister, I know you're going to say in your response that there isn't enough surgeries taking place in Letterkenny to justify two surgeons, because that's what the response that we get constantly, even though the department has agreed to appoint a second surgeon. And I would point out to you that about a quarter of the breast surgeons around the country actually don't carry out enough operations if the same figures were used by the department and enforced around the rest of the country. Currently, in 2015 there was 96 new cancers identified in Letterkenny, and in 2016 there was 89. And that, in my mind, justifies clearly that there needs a second surgeon to be appointed in Letterkenny, and it's not enough anymore to make excuses that there's difficulties around recruitment.
Thank you, Deputy.
Thank you, Chair. And first to both the deputies, to give the apologies of the Minister. Unfortunately, he can't be here. I don't know specifically where he is, but I've been asked to take the topical issue, and I will. In 2007, recognition of a particular and unique geographical circumstances applying to Donegal, the Department set out a very clear policy direction approved by Government that Letterkenny Breast Cancer Service should operate as a satellite centre from the University Hospital Galway. Specifically on a sole expect basis, Government agreed that Galway would be permitted to enter into outreach services delivered in Letterkenny as an additional activity. This exception was subject to a number of conditions, including case volumes meeting the minimum criteria and other quality assurance standards being satisfied at the same base as for care delivered in Galway. The Salsa Hospital Group remains committed to continuing the Letterkenny service as a full integrated part of symptomatic breast disease services in Galway, including through a joint multiple discipline team approach. The Letterkenny services have been run by a single consultant who has also undertaken general surgery at the hospital. Support is provided by the Galway-based consultant who travels to carry out clinics in the Letterkenny service to meet the arising needs. Letterkenny services have been under some pressure to meet key performance indicators of late, while a particular focus has been maintained on urgent referrals. Challenges are arising in relation to addressing non-urgent breast cancer referrals in a timely way. A locum consultant surgeon will be placed for a period from mid-May, and this appointment will help to alleviate the backlog. Meanwhile, the requirements of Letterkenny breast cancer services in the medium terms are being assessed. This has been done in light of the clear evidence that patients who are operated on by surgeons who carry out high volumes of surgery achieve better outcomes. Also, efforts to recruit GP support and further advance nurse practitioners support for the Letterkenny services are continuing. The possibility of a medium-term requirement has been addressed in cooperation with the Health Service in Northern Ireland. It also explored including the possibility of having a shared locum consultant. This will build on the cooperation already in place in relation to radiology therapy services in North West Cancer Centre in Altagilvin Area Hospital. This centre opened in November last year and is providing access to radiotherapy services for people from both jurisdictions. Radiologist post for Letterkenny University Hospital has been advertised. Also, a locum radiologist is being sought to provide cover for radiology services, and radiographic numbers in Letterkenny have increased, and the hospital will continue to develop its radiographic services to meet the needs of the patients. Minister Harris recently met with patients' representatives from Donegal to discuss the cancer services in the North West, and further such meetings are planned. Minister Harris also remains committed to the continued provision of a high-quality, timely service for patients attending breast cancer services in Letterkenny University Hospital. I will come back and answer.
Thank you, Minister. Thank you.
Thank you for delivering the response anyway, and hopefully you take the message back to the Minister, Minister Harris, that we're not satisfied with the answer that has come here today. And I think it's important, if you look at even in the response, you say that the requirements of the Letterkenny Breast Cancer Service are being assessed. And this has been done in light of the clear evidence that patients who are operated on by surgeons who carry out higher volumes of surgery achieve better outcomes. Where is that clear evidence? As I said earlier, I think something around about 25% of the surgeons across the service and the so-called centres of excellence actually carry out less than the 50 operations that are touted as being the desired amount to justify having a breast surgeon. So, and even that figure of 50 is not backed up by any clinical evidence or by any research internationally at all. It's clearly an arbitrary figure that has been picked out by the HSE in order to stifle the development of services in places like Letterkenny, and that's wrong. And the ministers need to deliver on their promises. And we have attended meetings. I've attended some of the meetings that took place previously with previous ministers around the cancer services in Letterkenny General Hospital. And we hear plenty of kind words and kind sentiment at those meetings, but we see no delivery. And there has to be, in my mind, something going on behind the scenes. And is it that we allow the system to run down to such an extent that people will be happy to go to Galway, and then the HSE will achieve what they want and actually closing the service altogether in Letterkenny?
Thank you, Deputy. Dodge.
I suppose a number of things just to remark on more than anything else, Chair. One is, I suppose, regarding Deputy Patrick Cope Gallagher requesting a meeting with the Minister. I certainly will pass on those remarks. My understanding is from the reply that every effort is being made to fill the post, and unfortunately somebody hasn't been, it hasn't happened at the moment. There's a clear indication from both of the TDs that there is concerns regarding the service in Letterkenny, and as a woman I just want to add my voice to that. I really believe that to give women a peace of mind, it's an awful time in your life when you're being asked to attend a breast clinic, and the only thing that kind of quenches your fears is the fact that you get a speedy results to the diagnosis, one way or the other. And I do understand perfectly where women who are in that position, when they go to a breast cancer clinic, they need to be able to give peace of mind, one way or the other. I think is very important, and I will relay that on. I cannot comment on both of the deputies referring to this being a direction that was taken prior to a general election to announce this. I have no comment on that, but just to say I don't think anybody would try to deceive anybody in any way coming up to election around anything as serious as appointment of a senior consultant for breast cancer. I want to I suppose to thank both the deputies on behalf of the Minister, and he does apologise for not being here, but I will make sure that he has a copy of my notes when I go back up to my office and respond to particularly the fact that Pat Cope-Gallagher would like, Deputy Pat Cope-Gallagher would like a meeting to take place with the TDs in Dun